Hi, everyone. So this is live on a Monday. This is the live on a Monday that was supposed to happen last week because I had both kiddos sick last week. My eldest actually got pink eye, and then we all got pink eye. So it was great, which is why I missed the live. So I'm sorry for not being on there, but I am here today. We're going to cover pink eye free, which is great. All the kids are back to daycare. Everyone is feeling well. And today on this live video, I'm going to talk about the low progesterone. So if you're new here, I'm going to share my screen and show you the thing that I am talking about. But this is the handout that I made. 5 conditions that are preventing you from getting pregnant and what to do about it. We're going through this one by one. These are the 5 most common things that I see women struggling with when they're coming to me to ask for help. And the biggest mistake that I see the conventional medical system make is that they finish the diagnosis. They say, oh, you have low progesterone, or you have PCOS, or you have endometriosis. And then the searching stops at that. That's the reason why you can't get pregnant. So now let's try to fix this issue, where I like to take you deeper and help you understand, why do you have PCOS? Why do you have low progesterone? So we're not just supplementing with progesterone and hoping that you'll get pregnant or that the pregnancy will finally stick. So we're going deeper and we're empowering you on a deeper level. So if you don't have this handout yet, go ahead and comment 5 conditions, whether you're watching this live or if you're watching this on replay, and I'll make sure to get that into your inbox. So the 5 main things that we have gone through, we've gone through the polycystic ovarian syndrome and we've gone through endometriosis. So if you have missed those videos, feel free to watch them in the guides section. The thing, we are going to cover fibroids and we are going to cover autoimmune conditions. We're just kind of jumping around. The thing that we're going to talk about today is low progesterone. Luteal phase defect is the other thing that this is commonly known for. So first of all, I want to talk to you a little bit about what is low progesterone. And I'm actually going to see if I can pull up a picture here of the menstrual cycle chart so I can help you explain what is low progesterone, why do women struggle with it, and more importantly, what can we do about it? So this is my favorite picture, and let me just share my screen again. Of the menstrual cycle, because it helps you understand the shedding of the uterine lining, the thickening of the uterine lining, and then of course the shedding again. You can see what happens to your temperature, that after ovulation, you tend to increase your temperature when the luteinizing and the follicle, the LH hormone surge, the estradiol, the estrogen surge, and then we see this progesterone guy, right? So progesterone is supposed to be high in the second half of the cycle, and it's supposed to increase post-ovulation, peaking about 7 days post-ovulation, and then slowly coming off in another 7 days. So it's really important that this phase lasts at least 10 days, but really we're looking for this phase to last for 14 days. And so let me write that down so you guys remember that. This phase is after ovulation. It needs to be at least 10, but really 14 is ideal. Now, the reason that's important is because after ovulation here, and you see ovulation, the corpus luteum is formed, the body needs time for implantation before we get this surge of the uterine, before the hormones drop. Because once the hormones drop, the body is being told that, hey, we need to get rid of this uterine lining. We're shedding, we are not fertile. There's no fertilized egg that has been implanted. But there might be a fertilized egg, it just hasn't had a chance to implant. So low progesterone is commonly associated with recurrent pregnancy loss, but sometimes women might not even get a chance to get pregnant if their phase only lasts 5 to 7 days. So this is where we start to look into the luteal phase defect. The luteal phase is this phase, and it needs to be about 10 to 14 days because that's how much time your body needs in order to be able to implant the egg. So that's why that's important. And let me see if I can share this. So basically what I want you guys to understand is progesterone is a steroid hormone, and it's actually produced by the adrenal cortex and then also in the ovaries. The corpus luteum is something that forms it once there is a pregnancy, and that's going to stay forming the progesterone as well throughout the pregnancy. But you'll see that progesterone is really important for conception, and it helps to regulate our menstrual cycle. It's just like a super duper important hormone. It's important for pregnancy. And what progesterone actually stands for is progestation. So we need it for supporting the entire pregnancy. And if a pregnancy does occur, it will continue to be produced by the placenta, and then it will stay elevated. But if there is no pregnancy, it drops like you saw, and then we get the lining, the shedding of the lining. Now, I'm really about prevention. I want you to understand if you have low progesterone, because the way that you're going to measure it is through blood. So blood test is kind of the standard diagnosis. And now you cannot measure progesterone whenever. It doesn't make sense to measure it whenever, because I'll pop back quickly over to this side. If you see it here, if you measure progesterone here, it's going to be low. 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 We need to measure it on this peak to help us understand if ovulation occurred. Measuring progesterone at peak, so 7 days post-ovulation, can give us a really good idea as to what's happening. So now, if you have no idea when you're ovulating, now I don't want you to use LH strips. I want you to use your cervical fluid production as the way to tell if you're ovulating or not. And I have a great menstrual cycle training on that. If you want that training, just go ahead and message menstrual cycle in the comments, and I'll tag you in that video, because the high estrogen production is the thing that's going to produce a bunch of cervical fluid for you. The more there's crypts that are on the side of the cervix that are sensitive to estrogen. So when your body peaks in estrogen, that's why you get that really heavy flow of cervical fluid, or you should. So if you don't have that, then we know that there's potentially issues with ovulation. The peak of estrogen is not as high. The estrogen is low. Maybe the estrogen is high all the time, so you're producing a little bit of mucus all the time. It basically just tells us if there's dysfunction in your hormones. But the point here is 7 days post-peak production of cervical fluid, we need to measure your progesterone through blood. That's the best way, the diagnostic way, if you will. Now, women will say, but what if it's low? Like, what if I was already on the second half of my cycle? Remember, the importance here is that the second half of the cycle lasts for 10 to 14 days. So if you're already starting to drop here at 7 days, it's not going to be enough time for that fertilized egg to implant into the uterus. Okay. So we measure on day 7, and maybe you hit your peak on day 5, but that's a problem. That's a problem that you're hitting your day at peak 5. You need to hit it on day 7, and needs to stay for a couple extra days. So you give your body enough time to for the egg to implant. So when we look at the blood, like I said, you're looking at that. We want to draw, and there we go. 7 days post-ovulation. It's really important that you know when that is. And now note that these numbers, I have 2 measurements depending on where you are. So 10 versus 0.31 nanomoles. That is levels below this number. So we want the levels way above these numbers in order to help us understand what is ideal. Now, my brain is blanking on the measurement, the ideal measurement in nanomoles, because I'm used to nanograms, if you will. And so this, you're looking for 30 to 60. That's your ideal. That's 7 days post-ovulation. And, you can convert that if you'd like, but we need high numbers, right? We need high numbers. That's how we know there's that big curve. And so if you're not doing this, or your body is not doing this. I'm all about prevention. So you need to understand what are some signs and symptoms that you need to look out for if you have low progesterone. And our progesterone is our calming hormone. So women who don't have enough progesterone will tend to feel much, much worse in the second half of their cycle. So they'll have a lot of anxiety, depression. They might have sleep disturbances like insomnia. Then progesterone is also our thermogenic hormone, meaning it helps your body heat. If you don't have progesterone, what's going to happen is you're going to feel a lot colder. It also helps with fluid retention, or allows us not to retain any fluid, allows it to pass in and out of tissue. We typically need a little bit more sodium in our second half of the cycle. So again, when we have low progesterone, we're going to notice more fluid retention issues, and you're going to have shorter cycles, right? So you can have that 21, kind of 24-day cycles. You can also just have straight up irregular periods if there's not enough progesterone. And then, of course, you're going to get some spotting. Now, the reason that we get spotting, I want to show you on this again, is the thing that initiates the bleed is the big drop in the hormones. So when your hormone doesn't really peak and then it goes really slow down, what happens is your body starts to spot until it registers this big fall. And so really important to pay attention to that, like spotting for half the day before you get your period is normal. Spotting for 2 days, 3 days before you get the flow isn't normal and a big sign of low progesterone. Okay, so you want to be on the lookout for that. Now, let's talk about progesterone. What actually causes it? And I want to explain something to you. I'm really big on taking things to the cellular level. So when you have low progesterone, the question is always why? Why do you have low progesterone? And so then you look at, well, what are the building blocks of progesterone? And then you look at, where is progesterone made? And so the building blocks of progesterone, just like every other hormone, is we need cholesterol. So we need high quality fat, we need proteins, and we need vitamins and minerals to do the work to actually build the hormone. Where that happens is in the mitochondria. Our mitochondria is the powerhouse of the cell. This is taking you back to grade 11 biology, where we learned about the nucleus and the endoplasmic reticulum, but the mitochondria is the thing that produces ATP. It produces energy, but it's also where we produce our sex hormones, our progesterone, our estrogen, our testosterone, and where we produce our cortisol, aka our stress hormone. So my women who I see with low progesterone usually also have what is in our alternative field now known as adrenal fatigue. They're exhausted. They have low hormones in general. They don't have good libido. They're anxious, they're stressed out, they're depressed, they can't sleep. So we see how, if you've been following my content for a while, how there's so many other pieces to it. It's important to understand that you have low progesterone, but what I teach is that your health will reflect your fertility potential. So if you can't sleep, if you have poor digestion, if you're stressed out, if your hair is falling out, you have all these things going on, that is not in a state that your body is capable of building a human from scratch, which is the hardest thing that the female body will ever do. And one of my theories is right now is that we are so stressed, like as a society, and then of course as women, that when we are under so much stress, our body is just not in a place where it wants to create. It's too overwhelmed. So we need to figure out what's at the root cause. Okay, stress is one of them. But please know that your adrenals don't just stop producing cortisol at the age of 30 or 35 or even 40. And this is why we take it down to the cellular level. What is happening in the cell? And this is when we talk about mitochondria, okay? And I'm going to tell you here what I say, what causes it: oxidative stress. What is oxidative stress? So basically accumulation of oxygen reactive species in cells and tissues. And what it does, it is super damaging to the mitochondria. I talk about the mitochondria here, but what causes this oxidative stress is chronic infections, inflammation, and environmental toxins. These are all the things that are preventing, that's impacting your mitochondria. And then you talk about not eating enough food, your body not being able to absorb it. So now you don't have the building blocks, and then the mitochondria is damaged and the body can't produce the progesterone. This is the level that I want you to think about when you're thinking about why can't I get pregnant, right? The deeper, the more we go to the root cause, not only the more it's going to make sense to you, but when you get down to that root cause and start treating the root cause, your body's going to respond very differently than let's just take some progesterone. Now, don't get me wrong. Sometimes we do need to take a little bit of progesterone to help manage our symptoms that we're experiencing now, but understand that that's a very short-term fix. That's not a long-term fix. And we need to get down to that root cause. I know I sound like a broken record, but I hope we're getting there. The other thing that I really wanted to show you, this is in research, that elevated histamine levels will actually also slow down progesterone. And it's basically progesterone production is blocked by histamine levels, prolactin, and then low cyclic AMP, which again is just a secondary messenger. So when I have people with seasonal allergies, autoimmune conditions, high blood pressure, eczema, psoriasis, anemia, all those things also block the production of progesterone, but it comes down to these chronic infections, chronic inflammation. It's all bogging down your mitochondria. So really the first step in treating anything is understanding, first of all, what do you have? And then why do you have it? Because I have 5 different cases of low progesterone that I'm working with, and not single one of them has the exact same reason. We see patterns. For example, we see parasites in the gut. We see inflammation in the gut. We see allergic reactions to certain foods or food sensitivities, but not one single person has the same measurements. Okay. So really start thinking about it. Is this individual thing for you, helping you figure out what's going on for you? So when you understand why you have low progesterone, then we can start to fix it. And like I said, it can be an autoimmune condition, a chronic histamine response, or chronic inflammation. And really, then the treatment is going to be based out of that, using antioxidants to support ovarian function, right, and immune system, getting rid of plastics out of your system. They're endocrine disruptors, and this is a major theme here. Detoxing, making sure that we're managing our stress, improving our sleep, diet, hygiene. I'm always going to give you the general statements of here are some of the things that you can do. But truthfully, you guys, if you are searching and you know you're struggling with low progesterone and no one has ever measured it for you, or they've measured but just gave you progesterone and you want deeper answers, this is on you now to say, hey, maybe I want to get down to the root cause of this. And I'm a big proponent of, like, you get to decide. You get to decide what you want to do. If you want to get down to the root cause of your progesterone, or if you just want to take progesterone and be okay, manage the symptoms, just get through the pregnancies, and then that's that. You get to decide how you want to do things. My approach is very much getting down to the root cause. I really like understanding what's going on in the cell, teaching you, helping you understand why is your body not doing the things that it's supposed to be doing. Because again, remember, pregnancy is a natural process. So when things aren't happening, we gotta figure it out. Now, I see and hear a lot of women say, okay, well, if pregnancy was a natural process, I thought it would just be a breeze. Listen, I thought so too. That's why I'm in this space, because I thought, as a naturopathic doctor, as an athlete, gym owner, whatever, I thought that this would not be an issue for me. But pregnancy was no joke. And I was so surprised of how difficult the process was. So that's why I'm here today, because I want to educate you on this so you don't have to go through it. And if you're already going through it, just know that there are answers, but you have to be open to seeing more than your diagnosis and ready to do some testing, ready to take some risks, ready to see what might be wrong, right? It takes a lot of courage. But I'm telling you, I have 5 different cases of low progesterone, and not a single one of them have exactly the same lab panels. Like I said, there's similarities, but as soon as we tweak and fix and supplements and diet and lifestyle, all of a sudden things click and boom, 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 they're feeling much better. And we're starting to see the decrease in signs and symptoms. And then, of course, when it's time to try to get pregnant, then we're doing that, and I'll keep you updated on those cases. I'd love for you to tell me what was the most insightful thing that you learned in this live. And if you want a copy of this handout, make sure you comment 5 conditions. And then if you want to watch the menstrual cycle video, make sure you comment menstrual cycle, and I'll tag you in that video. I want you to learn. I want you to understand how your body works. And if you need some help, you can message help in the comments, and I'm happy to start a conversation and see if I'm the right person to help. Okay, thank you guys for your patience. I'll see you again on Thursday, and we'll chat soon. Bye-bye.